Hello, everyone, and thank you for joining us on the Akkad and Koka Report. I'm Michel Akkad, joined also by my co-host Anish Koka from an undisclosed location. And we are delighted to have as our guest Elise Amez-Droz, who is program manager for the Open Health program at the Mercatus Center at George Mason University, where she manages the health policy portfolio. She is a public policy fellow with the Fund for American Studies and a member of the millennial cohort of the American Enterprise Institute's Leadership Network. But we're here to discuss an excellent piece that Elise wrote just recently on the website of the Mercatus Center for an online magazine called The Discourse. And the piece is entitled, actually, I printed it out without the title, but I think the title is something like, well, you want to tell us, Elise? I'm sorry.
Sure. Yeah, I think I have it there too, but labeling us essential or non-essential makes us less human.
Labeling us essential or non-essential make us less human. Elise, welcome to the show.
Thank you so much for having me.
This is, we're very happy to have you. This is a great piece. I thought it was very carefully written and intelligently written, and calls into question the distinction that is now, as you mentioned in the piece, almost second nature to us, of essential versus non-essential worker. But this is something that's sort of sprung up on us. Tell us a little bit what brought you to, what drew your attention about this topic, and what made you write this piece?
Yeah, so back in December, at the beginning of December, I noticed a headline at the Reuters website about Uber asking the CDC to be classified as top priority for vaccine distribution for COVID. Mm-hmm. And I thought to myself, well, okay, that's not completely unusual, like companies trying to lobby the government to get something they want. But it was seen as kind of a normal thing at that point. Like a big company would be asking the government to get a huge favor, like get priority access. It's a little bit like, to try to contrast it, like if 2 years ago Uber had come to HHS and said, well, our drivers do a very important service, they offer rides to people, they deliver food, we should have access to ER, like we should be able to cut the line when we get to the ER if one of our drivers has an issue. That would have been crazy. I don't think anyone would have accepted that. And so the fact that by the end of 2020, after the pandemic, this was kind of acceptable for a big company to do was quite shocking to me. And I wondered, why is it? Like, what happened in the span of a year that now a company can make this kind of demand and no one bats an eye? And I think it came down, that's when I started thinking about the word essential. That's the claim that they made. They said, our drivers are essential workers. They provide essential services. Therefore, they need to be able to get the vaccine. And it made me think about this term, and kind of, I started looking back kind of at the history of it, whether it was something that was common, like commonly used before, essential services. Is this a new pandemic related term, or has it been around for a long time? And perhaps by way of illustration, I looked at the Wikipedia page, which is, it's not science, but it kind of tells us a little bit about the background of a word. And so the page was created back in the early 2010s. And it was solely focused on a term that was in a report from the International Labour Organization that was trying to determine what was essential when a strike happens. So if workers are, like, whether workers are allowed to strike or not, based on their profession or the service that they provide. And at that point, the International Labour Organization said, so these are the services that cannot, like, well, the ILO is not mandatory, it's not binding, right? But it's giving guidance to countries. And it said, if you're in one of those professions, we recommend that they're not allowed to strike, and you find other ways to compensate them or give them a voice when they want to express something. And they also clearly said, for non-essential services, they're allowed to strike, but after some time, if the strike lasts too long, you can't actually strike anymore because the service becomes essential. What was non-essential becomes essential. So that was the basis for the article from when it was created. And then I looked at the history of the versions of the article over time, and it wasn't really changed until February 2020. And that's when the paragraph about the ILO became smaller and smaller over time. Now it's just 1 or 2 lines. and the rest is about pandemic-related services. And so this is really a new concept that we've classified things as essential or non-essential. And I think that the term has taken on a meaning that is quite different from what we understood it to be at the beginning.
Okay, very interesting. Now, do you know if in its original usage, was it ever used in legally? I mean, are there laws that referred to essential workers pre-pandemic having to do with strikes, or is just a term of a technical term of trade, if you will, among labor organizations?
As far as I'm aware, and I'm not an expert on this, but as far as I'm aware, it's not a legal term. At least, well, in 2013, there was a bill in Congress that was trying to determine what were essential workers for the purposes of furloughing. So kind of a little similar to the International Labour Organization. The bill didn't even pass. It wasn't enacted. So it's not really a mainstream concept. It's not something that's usually applied.
Right. But it's an interesting aspect because, I mean, I don't know. I mean, I'm sure there must be some people who are not allowed to strike. I suspect some government employees must, I mean, clearly soldiers can't go on strike, right? But I don't know if there's actually a legal term of essential workers that applies to the general population. And probably
Right,
not,
and
right?
I'm not sure about that, but what I do know is, and as like you said earlier, this is like second nature now. We use the term much more now than we ever have in the past. So I think that's really where my piece, like what I was trying to say with my piece, is it's now something that we all think in those terms: essential, non-essential, and it's kind of a non-negotiable. And the moral weight that comes with that word, it's a really loaded term. It gives a sense of life or death, which is quite a new thing for the government to kind of slam on a profession or on a person.
Right, essentially on a part of the population, and that comes through very nicely in your piece here. And again, do you know? And maybe it's hard to know because who in the pandemic era, who originated? Did this start in Europe? Did it start in the US? Did it start in I'm in San Francisco. We were the first one to lock down, so we have that claim. And I don't know if we're the first one to use the term essential versus non-essential. Do you have any idea?
I don't actually know. I really want to know. I've just seen it happen everywhere, like around the world, but the WHO as well. So I'm not entirely sure.
Okay, very good. So yeah, they as you said, and it's kind of there's a sentence you say here: governments took on the task of classifying activities as essential or non-essential, but it resembled more an exercise in creative writing than anything scientific. Can you elaborate on that? And you do in your piece, but tell us a little bit more what governments have decided is essential versus not essential.
Yeah, so I mean, again, essential gives the sense of we can't survive without it. Like this is something vital. But the very fact that there are differences between states about what is essential kind of tells us that it's not really that clear cut, right? So, for example, from the get-go, liquor stores were considered essential, even though, I mean, arguably, people should be able to survive without alcohol. I don't know, or cannabis dispensaries as well. And then in some states, well, for example, surgery and some types of healthcare were considered non-essential, which is quite a departure from what we think of as, especially a developed economy. Everyone should have access to care. That's a huge siren song, and so that also is something that I thought was really surprising. And so it seems arbitrary. And then golfing, I noticed. So obviously we know that some politicians broke the rules or officially was not allowed, and then some were able to do it. Veterinary care, it really depended on the state. So there are lots of distinctions that make me think maybe there isn't a real common understanding of what the term means.
Right. Now, is there, to be fair, is there at least a face value plausibility to the idea that some occupations are more essential than others, at least in the short term, while we, flatten the curve or whatever else we're supposed to be doing? And what are your thoughts on that? I mean, is it plausible to think that certain activities are more essential than others? And
absolutely, yeah, I would never dispute that. It made a lot of sense, especially at the beginning. We had no idea what the virus was going to do. we didn't know how deadly it was, and we just needed to do something. Like governments weren't just going to sit back. So that's not really the issue. I think the biggest problem is really the choice of the term. I think it's kind of characteristic too. Maybe I'm taking this too far, but it's characteristic of kind of the Twitter era, where we need something that fits in a tweet. It's like a really short way of like describing something. And so we went with essential when actually at the beginning, in the original order from President Trump at the time, he said, we're looking to select critical services. And so the term was critical.
Mm-hmm.
And then it became critical essential in the follow guidance. And now it's only essential. So I think that's really the problem. The problem is not really determining. And I think that definition should have evolved over time. And it has. But we've just kept stuffing more professions under essential instead of calling them something else.
Right. That's actually a very interesting point. I think critical makes sense. As a term, but critical would mean definitely that, I mean, it would sort of focus the attention on the fact that this would have to be a very short-term use of the distinction, because only a few, very narrow things are critical to just keep the country going, so to speak, at the bare minimum. Whereas essential is clearly a lot more encompassing, as you know, and it's and you're right. But I mean, because even when they say, well, food is essential. Of course, food is essential. So the food industry is going to be essential. But what does that mean? Does that mean the candy store, or around the corner? And can they claim? And then you see all kinds of creative adaptations to that distinction, where a place that might serve cookies all of a sudden is going to serve bagels, or find a way to stay open, or to remain essential just to fit the definition. But is there a way that it could be done? I mean, do you think the problem is in the manner that it was done? I mean, do you think if, as you say, the government had to do something, how should they have done it? What would they have done better?
Well, I think from, again, the choice of the term, but then practically speaking, it is also having the conversations on the ground, right, with the different people that are involved. Like if we're going to start forbidding people from working, then we need to hear, their side of the story and how they're impacted. And so perhaps another issue is just the top-down aspect of this, where the guidance came from the CDC, and even though it was guidance, I don't think it was ever mandatory. It really did shape the policies on the ground, and then city level as well. And so it was very much like at the stroke of a pen. That's kind of where I was going with that sentence too, is you just get to kind of define things how you want. So having a more flexible policy where we revisit, and it's harder to revisit when you've called it essential. It would be easier to say, this is temporary, we're going to try this, and then see how it works. And science is a big factor, and people are always talking about, well, the science is this. And especially last year, we saw the science is a discovery process, right? The whole point of science, it's from the Latin scire, to know. And so we learn, it's a knowledge process. And so over time, we learned more. And then we could have gone back and said, okay, we see that this is not really achieving its goal. And I know you've all talked about the lockdowns and all that, but I think it's along the same lines.
Right. I think you don't believe in science. I think that's what I'm sensing here.
Not
science, the science is settled. So what are the problems that have, I mean, did it at least help, achieve the goal of, flattening the curve, or did it, what are the consequences of this distinction that you see?
We've seen obviously that the lockdowns have not been quite as effective as we could have imagined at the beginning, and for sure the 15 days to slow the spread turned into 150 days and more. So that should tell us something about the effectiveness of the measures. But then the distinctions themselves. So one thing that I think is really dangerous when we focus on one metric, right? Like the whole point of this was to lower the number of cases of COVID and the number of severe cases and mortalities. But then what else might happen when we claim that care is non-essential? And so I think for the medical aspects, that was just, it's devastating. Like kids stopped going to the doctor. So we have lots of kids who could not get their immunizations last year. And cancer patients too, like follow-up treatments. There was just a study from a top medical journal saying that even a 4-week delay in care, in follow-up care for a cancer patient leads to higher mortality. And that's not hard, like in terms of just logically speaking. If you're going to delay care, you're more likely to have consequences. Screenings, I mean, who has gone to the doctor in a long time? I think lots of people postpone a lot of things, and we don't have all the numbers in yet, and we'll start seeing this unfold over the coming years. But that's definitely going to have an impact, I think. And there, what's interesting is that the government originally, governments, federal, state, determined what was essential care, what wasn't. For example, Centers for Medicare and Medicare Services at the very beginning, like in April, they created a tiered system where the top tier for priority was people with COVID and a confirmed case. And then they had the second tier for pretty much everything else that was like kind of needed attention. And then a bottom tier for immunization, not immunizations, I think some other screenings, routine wellness care. And they told their hospitals, or at least for those patients, just only prioritize the top tier as much as you can. And over time, that was relaxed, right? So we saw actually currently campaigns are going around the country telling people, go back to the doctor, you actually should go. But when you've told people for so long that that care is not essential and that COVID is the only thing to fear, I think it also makes a difference in how people view their need for healthcare services.
Right. It's interesting how it'll be, as you said, the numbers are not out yet, so we don't know what the the epidemiological consequences of this will be. I mean, it certainly could be dreadful. On the other hand, I think many will say, and to some extent, again, with some plausibility, that we do so much superfluous stuff because we're incentivized. Doctors, hospitals are incentivized to provide all kinds of services, and so to some extent, a lot of that superfluous stuff was stopped as well. And whether there's enough needed stuff. I mean, I'm sure people have been affected. There's no question about it. And it's always the case. There's always a misallocation, but it's possible that it may not actually show up in the numbers. Who knows? Who knows how that works? So certainly, yes, in terms of the medical care that is not essential and whatnot. Again, a nice line in your piece. Say, whether an illness requires immediate intervention is best determined by a medical professional. But today, everyone has a little doctor inside his or her head that performs this screening. And it's true that I mean, I think people were really, to this day now, are very confused. Many people are very afraid, don't know what to do. They've lost all sense of, and the doctors themselves, especially doctors who are, in maybe not employed by hospitals and so forth, we've just lost sense of what do we need. I have a patient, normally I would see them and examine them and so forth, and I sense that they're a little nervous. Do I tell them it's okay, I can remotely treat you without actually seeing you, versus no, you really need to come in because I want to make sure that my diagnosis that I've given you over the phone is actually correct? And so these are things that that we have to kind of calculus that we have to engage in, that we don't always do, probably don't do perfectly well. So yeah, yeah, go ahead.
On that, I totally agree. And I think that gets into a much broader conversation about the way the healthcare system is set up, right? It shouldn't be, ideally, there should be enough of an incentive for both the doctor and the patient to be working toward good health. And the current system, we know, doesn't really encourage that. It has misaligned incentives between what the patient needs and what the doctor can benefit from, or the broader hospital systems and whatnot. But it should really fall to the doctor, and the patient. And so in this case, this term and the way the system is set up has led to an increase in distrust in the entire system. Like you said, so currently people might be more inclined to trust themselves or trust their own definition of what's needed than the doctor.
It's problematic. It's problematic, this whole public health piece. More broader implications of these distinctions between essential and non-essential beyond healthcare, on how we relate to one another. You want to talk about that, or?
Yeah, definitely. And that was really what I was driving at with the piece too, is this term essential. I do think it's a very good question. What is essential? It's a question that we should be asking ourselves perhaps more. And the pandemic certainly has raised that for all of us. What do we really value? And so we realized that, yeah, the government might think that museums and performances and arts and eating at a restaurant instead of at one's dinner table is not essential. But over time, we've all realized, like, well, then what are we living for? What is going to make life fun? And so, yeah, I think that's a deeper thing. And also for the meaning of work, I think that's a big piece. So at the beginning of the pandemic and still currently in some places, people were sent home being told your job is not essential. And I was one of those people. I have a non-essential job, but I'm doing fine because other people think it's essential. I don't need the government to think it is. So I've had a great year, actually. I'm very, very grateful for the past year and all I've been able to do just from my home. But for so many people, that's not the case. So they're told you're not essential and they lose their livelihood and kind of what gives them purpose every day when they wake up, whether it's waiting tables or it's cutting hair. And I think that's a very big that has consequences. And we know that mental health has really gone down last year in terms of the numbers. Like at least the Gallup poll that I saw that I thought was really striking, it's gone down for everybody, right? People, rich and poor, all ages, all political parties. There's one type, actually, one group of people that had an increase in their mental health, and it's people that go to church weekly. Interestingly, and that was considered non-essential, actually.
If they're allowed, right? I mean,
right, exactly. In 11 states and the District of Columbia where I live, that was considered non-essential. So that's really calling into question the ability of policymakers and perhaps just society as a whole. We each have different preferences and different things that are essential to us. Like to me, it might, like, some things might be important and essential to my well-being that are not for others, and that's damaging when someone who doesn't know me personally gets to make that decision for me.
Anish,
do you think that the part of the problem with the whole essential non-essential divide and how we kind of separate this out relates to who is kind of making that decision? And it feels like we've kind of farmed out this decision to public health experts. I don't want to be too mean to them, but they don't appear to necessarily have a lot of what is essential, what is not essential. So, do you feel like that is part of the problem? Is that we kind of, as a society, as the decision makers, seem to look to public health to decide what's essential and non-essential, as opposed to letting local communities kind of make that decision.
Definitely, the past year has kind of shown the huge authority and power that public health experts have now. Like they get to make decisions on things that have very little to do with public health, and I think that's due to the fact that the meaning of public health has been stretched so much over the past decades. And now it used to be, I mean, the old model of public health would be just to limit the spread of communicable disease, and now it's pretty much any pathology that affects a large number of people is considered to be public health. And now pathology is also broadly defined, right? So it could be a social problem, like inequality apparently can be a public health problem. And that's just really stretching it way beyond what it used to be. And so, yeah, like if those people are the ones informing policymakers about how to define an essential service, then obviously that's going to have repercussions.
Yeah, no, I really think that's such a huge problem, because you take a group of folks that are, that are a relatively elite crust of people, that, their children are in private schools. I mean, they just are not, they don't have the, they're removed from the struggles of small business, and you end up with a very, very interesting, or interesting is a very polite word, but you end up with a very interesting list of who is essential and who is not essential. And I just think it's so demeaning. I mean, why is it that, and also, of course, that group of public health experts, it doesn't help that they are all cut from the same, from a very, from one ideological cloth, right? So they're buffeted by political winds, and so, who they deem as essential and non-essential may not necessarily have much to do with what a local community needs, right? So I still am flabbergasted that that education is not, education for children is not considered an essential service. Why is it that teachers are not considered essential? Why is it that they're allowed to, be remote, whatever it is that they're doing, which is completely, and that has much incredibly, and public health folks are usually big proponents of teachers units. So, again, I think one of the I don't know if you explicitly mentioned it in your piece, but one of these ideas of this essential non-essential divide that exists, in part relates to the fact that you have a group of folks that are completely unplugged from the practical realities of local communities kind of making these decisions.
Yeah, that's very true. And it's also, interestingly, and not coincidentally, I guess, a lot of the essential workers were public servants, or people, not public servants necessarily, but people who were working in the public sector. And if I'm not mistaken, I think education is technically considered essential, but it's again like having the provisions made for them. So there is a lot of public money that's being poured into public schools, obviously, right now, to make remote learning happen. Now, whether that's working is a different question, but you're absolutely right. It seems to be a very small group of people that are quite disconnected and themselves not impacted by the decisions that are made, that are making the decisions for other people.
A big issue in my mind is really, to Anisha's point, to some extent, I think is whether we recognize how social human beings are. And I think the people who make those decisions have been sort of, drawing these distinctions between essential versus non-essential, tend to focus on one individual with its, vegetative functions, and what does it take to to keep people, people's vegetative nature going, and anything that has to do with our social dimension is viewed as essentially superfluous, because if it's not essential, then it's superfluous. And that's really that's terrible, especially, of course, in the long run. I mean, you can do it for a couple of weeks and whatnot, but in the long run, it's really extremely damaging. It has nothing to do with reality, and the idea that you can sustain that just by throwing money at people, saying you're superfluous, but we're going to give you a paycheck, and so long as you keep your distances from everybody else, and we'll pull through this. And now it may take 2 years, 3 years, 4 years. People are talking about 10 years of this, and once the term, as you mentioned at the beginning, Elise, is introduced into the consciousness and accepted, kind of widely accepted, as if it's a natural distinction, then I think we have yet to see the real consequences of this.
No, I agree, and beyond, like, in addition to that, you mentioned as like human beings being social, like social animals, really, that requires like social interaction. And so I personally found that the word social distancing was also not an excellent choice, because it's really about physical distance.
Mm-hmm.
We're not trying to distance ourselves from people from on a social level. We're all trying to have social connections during this time because we are physically distanced. And so it's odd that those terms have arisen as if we needed to isolate ourselves. Even again, that's also a pretty strong term to say socially distance, when it's not really about the social aspects. It's mostly about the physical aspects.
Right. As if we understood those, even, and to compound the problem is that it's clear that we don't understand, or we have a very rudimentary understanding of how these things get communicated. Because again, at the same time, some people who were pro lockdowns were critical of the anti-lockdown group in their claim that they could, there was the Great Barrington Declaration, quote unquote, protect the vulnerable. And to some extent, I understand that argument, that it's very difficult to isolate the vulnerable from the non-vulnerable, precisely because we're sort of enmeshed with each other's lives. But that's even more the case when we talk about the distinction between essential and non-essential, right? We're so interdependent that to think that you can carve out, groups of essential people and groups of non-essential people is quite foolish.
Yeah, and it's a philosophical question at the end of the day. Is what does it mean to be human?
Mm-hmm.
And clearly, it's a kind of an ongoing question. Like all of us ask ourselves like this question: like, what does it mean to be alive? What is the purpose of life? And when there's a small number of people that get to make that decision authoritatively, and then that has real consequences, it's bound to have consequences, and we've seen that happen. But yeah, it is really problematic, because we are like society. That's how society works, is by people being together, where no man is an island, right?
Absolutely.
Go
ahead, Anish.
But I think the other big part is that it is so impossible for somebody to decide at the center of wherever they are what is essential to a community. For instance, Philadelphia, an inner city, a large inner city population, a very large school system, and the public school system serves many purposes. It's not just education. It's putting people in an environment that may be safer than the environment that they may have at home, right? It's very different from the education system that may exist in some suburb of Pennsylvania, where, when you're at home, you're not buffeted by the kind of the dangers that may exist in a different environment. And so, again, you had teachers backed by teachers unions kind of deciding that, okay, it's not safe to go back because we're not essential and we can continue to do X, Y, and Z. And you have multiple different episodes of children that are at home in dangerous environments that are shot and killed. I mean, it's really tragic. So I think it just drives home the point that these folks don't know what they're doing in terms of deciding for all of Pennsylvania, what is essential and what is not essential. Yeah. So I think you really have to let local communities kind of come to these decisions on their own. So, we have not learned that much more since Albert Camus and, writing The Plague and The Town of Oram. And, I think it's, that's why Elise's point is so well taken, that, it's this whole arbitrary delineation between what's essential and what's non-essential should be incredibly carefully done, and probably shouldn't be done in some type of central command and control structure, because they just don't have a clue of what's going on in a variety of different communities that exist.
Yeah.
Do you think, Elise, I wanted to ask you actually, do you think part of the problem relates to the fact that public health has been given this very broad purview that kind of extends to everything? You touched on that before, but is one kind of solution moving forward to limit the scope of what public health means?
Yeah, and again, I feel like I'm also beating my own dead horse with the meaning of words. But yes, I think that as words take on a new expanded meaning, or just it shifts over time, it is used to have certain policy, to make certain policy decisions. So yes, I think that for public health experts, because public health has been like, now it's kind of whatever a public health expert says, because everything has to do with health. That's kind of, I think, what you were getting at with what you said, Anish, about schools. Schools serve the purpose of education, but also socialization, feeding kids, protecting them from danger, daycare. It's all those different functions. But all of these affect our health, like the way we live, like everything we do affects our health in one way or another. So when public health starts addressing all of the pitfalls of our activities and the results, that the impact that they might have on our health, then yeah, whoever's an expert, whoever has an MPH or some degree like that, can make decisions that are far beyond anything related, like remotely related to healthcare. And that's something actually in my team, we talk about a lot about that, the distinction between health and healthcare. The healthcare services is really what like we should be focusing on, and with what public health is supposed to address is how do we use healthcare services to to control the spread of disease, and not look at the entire society and try to solve every problem. We just can't do that.
Right. You know, public health started off by, I mean, it was focused essentially on keeping bugs out of water supplies and things like that, which is fine. And then I think once they conquered that, then they had to find another purpose. And then they started looking at chronic diseases. Chronic diseases means looking at our behavior, and our behavior means everything. And so public health is everything, right? Everything can fall under the umbrella of public health. And so they can be absolutely totalitarian in whatever they want to claim and impose. Let's switch gear a little bit here, Elise, and tell us what your program, the center that you're part of, is trying to do to deal with this this growing public health totalitarianism.
Yeah, that's a great question, and we really do want to apply academic ideas to those problems. So Mercatus, just by way of background, we are a research center at George Mason University, and we conduct research that connects kind of the world of academia with policy issues. And so we always have a double-blind peer review process on our papers, and we try to have a really high academic standards. And so when it comes to addressing those issues, we have kind of a long-term view. Like we do want to see policy change for the better in the short term. That's how things, move forward for the better. But our goal is really in the long run. How do we take the conversation to where it should be? And so when it comes to public health, recently we're in the process of applying the economic framework, or at least the concept of polycentricity, which is something that Elinor Ostrom, who won a Nobel Prize in economics just in a few years ago for her work on polycentricity. It's this idea of polycentric governance. So instead of there being a top-down approach or a bottom-up approach, which is like kind of what we think of, with markets, it's like at the individual level, each person makes their own decision. When we talk about polycentric governance, it is overlapping circles or realms of authority that make decisions together. And so people have different preferences. They have different ways that they perceive the world, a little bit like what Anish was saying earlier, with the different localities having different needs. And so she built an economic framework around this idea of there being different levels of knowledge, different levels of needs, and also this core concept of co-production, which is really interesting and important, I think, for healthcare. You all know that you can talk to your patient all you want about how to take care of themselves and how to take their pills, but they have to take their own steps too to be healthy. And so healthcare is very much something that is co-produced between the providers or the physician and the person. And so that's this idea of polycentric governance. We're trying to apply that to healthcare, and we are currently studying the issue of public health with this. So studying the old framework of public health, how it's moved toward kind of an all-encompassing idea of all of the diseases that affect lots of people. And we're taking a particular look right now at the distribution of the COVID vaccine, because each state is doing it a little bit differently. And there are different competing interests there at the state level. So we're trying to apply that and understand how that might have shaped the distribution of the COVID vaccine, and what perhaps we can learn from this economic framework about how to, moving forward, do that better.
Very good. And what kind of programs do you put out? I mean, you have academic journals that you publish, and then you issue white papers or programs of that sort?
Yeah, we have white papers. So some of them are just our own papers that we'll publish on our website. Sometimes we'll do working papers where the authors hope to publish their paper both with us and with a journal. And so that's obviously the goal. It's always better when we can publish something in a journal as well, especially when there's a heavy econometric component. And then we also, once we have done that research, that's kind of where the policy component comes in. The findings are interesting, and the problem with academia, it's great. There are lots of awesome papers that get written every year and published, but they don't really reach the audiences that could do something about them. So our goal is to take our findings to policymakers. So we'll, present that, send it to the right people, the people that we think will be interested in the findings, and then brief them if they're interested, and we'll, be able to provide testimony if a senator or a legislator somewhere introduces a bill that is somewhat related to what we're doing.
Okay. How did you get interested in this? How did you, were you always, I mean, the Mercator Center is, as the name implies, it's kind of a pro-free market place, more, as you said, more decentralized decision-making and that sort of thing. Were you always of that ilk, or?
I think I was. So growing up, I always had lots of conversations with my dad about economics, and that was always something, it was kind of a natural thing. I think my dad has a free market bent, definitely in the way he perceives things. But it really hit home for me when I went to grad school. And so I was coming from Switzerland, where I had mandatory insurance. So because that's how we do coverage in Switzerland, is everyone has to buy insurance. It's not from the government. We have a pretty competitive, a fairly competitive insurance market. It's not nearly as expensive as here, but it is still fairly expensive. So I was paying quite a bit of money there. And when I came to my graduate institution, they told me that I had to buy insurance there as well. And I tried to argue both in Switzerland and at my school to say, I'm already insured. I don't need to be doubly insured. And so I think I ended up spending something around $8,000 on insurance that year. I never went to the doctor throughout my program. I did not need any of it. And I was like, I've never made, this is probably one of the most expensive things I've ever purchased, other than my degree. and I have no use for it. I don't want it, and I have to buy it. And that kind of got my wheels spinning a bit. I just started thinking about it more and decided that, I started exploring economics more and diving into specifically the issue of health insurance and also pharmaceutical, which is something that I had a bit of background in before. So those two things together kind of brought me to the field.
Okay, terrific. We had,
yeah. Elise is not good for business.
She's not good for your business. I specialize in keeping people healthy,
yeah.
But we had a Swiss physician, a couple of years ago, tell us about the Swiss healthcare system.
Yes, I did listen to that one.
You did listen to that, so we'll have that on the show notes. That was very good, Mark Furabulas. That's great, Elise. You write quite a bit and always very insightfully. Do you have a website, or is there a place where people can follow what you're doing, or a Twitter handle? Or
not really. I just got rid of my Twitter. That was part of the steps that I took for a variety of reasons, but mostly because I was sick of being fed other people's opinions about things. And so it's been better. I feel like I've gotten better at, looking for information on my, by myself and spending a bit more time doing my research. So no Twitter handle. I am on LinkedIn, which sounds like a very lame thing to say, but I guess following on LinkedIn is possible. And then other than that, a lot of my work is also coming out on the Mercatus Center's website. So mercatus.org is also a good platform to go.
Terrific. Speaking of being off Twitter, we are, officially anti-social media people now, so we cannot be followed. But for the listeners who enjoy what the programs we produce, please subscribe to the show on YouTube or on the podcast, any podcast platform, and continue to follow us. Elise, we're very happy to have had you on the show. It was terrific. I will link to your excellent article here, very insightful. And we wish you very well in you and the Mercatus Center, and look forward to following you.
Thank you so much for having me.
Thanks so much, Elise.
Thank you.